Mike Freer to move the motion.
Thank you, Mr Mayor. Could I associate myself with your comments, which are exactly right? Mrs Main, I beg to move that this House has considered the findings of the All-Party Parliamentary Group on HIV and AIDS 2016 report, The HIV Puzzle, Piecing Together HIV Care Since the Health and Social Care Act 2012. Mrs Main, it's a pleasure to serve under your chairmanship today, and I'd like to put on record my appreciation to the Minister and to other colleagues, but especially the Minister, who has been extremely supportive of the group and has always been helpful whenever I've raised issues relating to HIV/AIDS with her. I'm also grateful to other members for spending their time on, we know what is a busy day today, with other demands on our time, so spending time in the debate is much appreciated. Since I was elected as chair of the All-Party Parliamentary Group on HIV/AIDS in 2015, our main objective has been to draw on evidence from clinicians, patients, HIV charities and research groups who are concerned about the potential impact of the Health and Social Care Act on HIV treatment across England. For that reason, in December 2015, we started to collect written evidence to investigate whether these concerns were based on reality. The inquiry took about a year to conclude, and in that time we've heard from clinicians, local authorities, public health officials, people living with HIV and the charity sector, and we took both written and oral evidence. After a year of evidence gathering, I think it's fair to say that fragmentation has occurred, and that has created a degree of uncertainty, and that has presented opportunities for aspects of HIV care to fall through the gaps in commissioning bodies, which I'll outline later in my comments. The report's purpose, Mrs Main, was not to turn back the clock, but to reach out to the sector for evidence and recommendations that will make tangible improvements in commissioning HIV services. Because we need to work together to make those changes to ensure that people continue to maximise the benefits of what is a world-class treatment and clinical care service available in the UK. And I want to underline that the majority of the report's recommendations focus on the need for clarity and accountability for all aspects of the HIV care pathway. Because it's the lack of clarity within the Act that came into sharp contrast. It was exemplified by the debate surrounding the provision of PrEP and the uncertain future for HIV support services. I, along with my colleagues on the APG who advocated for central funding for PrEP, welcome NHS England's announcement of a new PrEP trial that will reach 10,000 people. But our report has concluded that the Health and Social Care Act has increased fragmentation on many aspects of the care pathway, from prevention to long-term condition management. Fragmentation has created risks to HIV support services, for example. A separation of sexual health and HIV services is another example, and there are now new potential barriers to testing and prevention, and most importantly, confusion over the commissioning of new prevention techniques. And I'd like to highlight key findings and offer some suggestions as to how the APG believes the report's recommendations can help address them. HIV support services, i.e. non-clinical services for people living with HIV, have long been considered a vital part of the care pathway for people living with HIV. The NICE-accredited British HIV Association, BIVA, which provides official guidance for HIV treatment and care, states that the following are necessary for effective long-term condition management. It states that we need peer support, support from other trained professionals, information about HIV treatment, information about healthy living with HIV, diet and lifestyle, and optimisation of general health issues. People living with HIV also need support around access to general health, financial advice, housing and employment support. This view is endorsed by NHS England, who argue, and I quote, "The effectiveness of HIV specialised services depends on other elements of HIV care being in place and effectively coordinated." And it should include the third sector HIV care and support services for treatment adherence, peer support and self-management. It should include social care, mental health and community services for rehabilitation, personal care or housing. Now, Madam Chairman, not everybody living with HIV requires support, and most will only need to use these services periodically, such as when they are newly diagnosed, experiencing employment issues, when they are pregnant, considering disclosing their status to others, or if they are experiencing discrimination. As for an example, the UK Stigma Survey identified that 28% of people diagnosed within the last 12 months reported suicidal thoughts. And sadly, the suicide rate for HIV-positive men in the first year after diagnosis is over 5 times higher than that of men in the general population. Similarly, when side effects of treatments have improved in recent years, many people still have real difficulty in managing them, especially when starting medication for the first time or transferring regimens. There are also people who are long-term diagnosed who experience ongoing and irreversible side effects of older HIV treatments, such as neuropathy, lipodystrophy, and most recently, there is emerging evidence on diabetes. Support services in these instances not only ensure that people have access to a trained professional or volunteer at the point of crisis, they also reduce the pressure on healthcare professionals. The National AIDS Trust reported that 50% of attendees at expert patient groups subsequently reported fewer GP visits. For an investment of £400 per attendee, there was an average net saving to the NHS for each patient with a long-term condition of £1,800. Positively UK also report that 88% of those reported, 88% of people reported that peer support has helped them to better adhere to their treatment plans. But unfortunately, we've heard from National AIDS Trust and other local HIV support organisations that HIV support services are vulnerable under the current Act because commissioning responsibility was not clearly defined. Therefore, clearly mandated service provision has instead taken priority, particularly where there have been reductions to public health grants for local authorities. Last year, for example, HIV services in both Berkshire and Oxfordshire were reduced by £100,000 between them. In Berkshire, this equates to a loss of a third of funding and will directly impact 300 people living with HIV in both Slough and Bracknell. In Public Health England's guidance to commissioners entitled Making It Work, HIV support services are the only part of the care pathway which has been left to be determined locally, as it states. This means that either the CCG or the local authority can provide them, but in a number of instances it appears no one is commissioning services such as community-based HIV clinical nurse specialists. The value of support services in other disease areas is well recognised. CCGs already commission cancer care and peer support for mental health services, and the Desmond, the Diabetes Education and Self-Management for Ongoing and Newly Diagnosed programme for self-management for diabetes. And as such, the APG has recommended that the responsibility for providing HIV support services is met by NHS England and CCGs as part of the patient care pathway provided for long-term condition management. Madam Chairman, while local authorities do have a responsibility to provide public health and social care services, the ambiguity in the Act and reduced funding means that this responsibility has been deprioritised. Support services sit comfortably within the mandate which CCGs and NHS England already have to provide HIV treatment and care. And I think it's important what we're asking is that the Department for Health reiterate that we need a whole treatment plan from start to finish, which is mandated. Yes.